Hey guys, my name is Praise Douglas. You're welcome to our YouTube channel. You're welcome to the various vlogs. So, guys, today I came to give you guys a good news, a super, super good news. If you've been wondering for a while now if the healthcare assistant job or the healthcare assistant route is actually coming to an end, I'm here to let you know that there was a good news, okay? The UK government has finally spoken. They have spoken, and it what they actually said is mind blowing. Guys, I'm not even here to bust your brains because we'll be reading together what they laid out, what they published on the Gov website themselves. It's like, how will I put it? It's like Jara on top Jara that came with this good news. So I bet you won't want to go anywhere because you want to know exactly what this news is all about. In today's video, we'll be talking about this news. I'll be trying as much as possible to explain what I understood based on what was published. And then I'll also be directing you guys to the site where you can actually go and start submitting your application. Guys, like, this news is everything. I'm telling you, it's everything. So if you want to hear about all what I have to say and also get a pic of the recruitment agency I'll be directing you to, consider staying to the end of this video. And if you've not yet subscribed, what are you waiting for? Shall click on the subscription button, and then on the notification bell so you get updates of videos whenever we post them, guys. If you're an old subscriber, thank you, guys. I really appreciate. Let's do this. Okay, let's go, guys. So, guys, for those of you who don't know about this healthcare assistant route to the UK, it's actually a route that the UK government started sometime in 2021, where they actually gave privilege for recruiters to recruit overseas healthcare assistants to come to the UK because they were struggling in the health sector, especially after the pandemic. So the healthcare assistant job was included among the shortage occupation list, which gave people the opportunity of coming to the UK. It's actually one of the easiest ways of coming to the UK at the moment. So many people actually utilize this route to actually move to the UK with their families, and start a new life in England, right? So this route was actually a trial. Okay, so the government of UK actually wanted to try the progress or the outcome of this route, and they did it for just 2 years, meaning that it's expected to end on the 15th of February 2023. So that is it. We are in 2023 and we are in February. So everybody has been wondering what's going to happen after February 2023. Is this route going to come to an end? Are they going to extend it? So many things have been in the mind of everybody. So we have always been on the lookout for any published news by the government of UK to tell us what is the way forward, and that is why I am here today, because we've gotten the good news. And without wasting much of your time, let's go directly to the Gov site so you can see exactly what was published. Okay, guys, so this is the Gov website, all right? And as you can see, this is International Recruitment Fund for the Adult Social Care Sector, Guidance for Local Authorities. This was published in February, 10th of February 2023, right? So, guys, we'll be actually going in to read what was said on this published article, all right? So now, this is the introduction, okay? Government can confirm that it is making £15 million available over 2023 to 2024 to help support international recruitment within the adult social care sector. Guys, isn't this loud? I mean, this wasn't like this before. Before now, most agency actually charging exorbitant amount of money just to help you, just to process your document for you to come over to the UK to work. Some persons started, using it for so many, how will I put it, dubious schemes. Some persons started. Some people have been scammed because they say you have to pay for this and pay for that. But right now, guys, you don't need to pay for any of these things because the government is actually making the fund available for you to come to the UK to work in the healthcare sector. Right now, the health sector is struggling with carers. Like, they've had a shortage. They have a high demand of carers right now in the health sector, because they're actually moving so many people from the hospital to go back home. Okay, and as such, they need a situation where they have to integrate the system, that those who have been sent back home need to be constantly taken care of. Either they are going to the care home or they'll be in their house, but they need carers to actually be involved in taking care of these individuals that have been sent back home. That is where you come in, right? That is where you come in, and as such, they need you. So I actually don't think that in the near future this healthcare route is actually coming to an end. As you can see, this provisional has been extended for another 2 years, guys. It's here to stay till 2024. Okay, and they are actually sponsoring this route right now. Let's go ahead, guys. So, guys, it says the government is committed to helping providers make more effective use of international recruitment to help grow the adult social care workforce, alongside wider actions to improve domestic recruitment and retention. On 15th February 2022, care workers were added to the shortage occupation list to support providers in addressing workforce pressure. This inclusion is enabling the sector to employ overseas recruits to help provide care this winter and beyond. So, guys, you see, this particular healthcare route is not going anywhere. Like, it's here to stay, guys. It is here to stay. And apart from recruiting overseas applicants, those already who are in the UK, they have opportunity of also changing, or getting the sponsorship visa very easy now that this whole fund has been made available. So one of the reasons why most of these recruiters are kind of skeptical in actually recruiting overseas candidates is because most of them actually pay 1 or 2 Bs in getting this sponsorship and all of that. But right now that the government is actually releasing some funds, I believe it's actually going to make the whole work easier for them. Okay, it's actually going to make it easier for them to recruit applicants who are interested in working in the healthcare sector. So, guys, this is good news. This is everything, guys. What are you waiting for? If you are interested in actually applying to come to the UK as a healthcare assistant, guys, please, no need to waste your time anymore. Rush now. Go and start getting your documents ready. This particular route has nothing to do with certification and all of that. It's majorly about your experience. Okay, it's majorly about what you can offer. Can you do the job? Have you had any experience so far? So if you've not yet gotten experience, I think there's enough time for you right now to start going back looking for how to get experience. There's so many care home back home, maybe in Nigeria or wherever you're watching from. You can actually go there to get 1 or 2 experience. And also, if you also can get any little certification, is also a boost. But mind you, this program look more on your experience and not your certifications. Okay, so let's go back to the article. Okay, the published article, to see everything entails in this new funded route. Okay, I'm super excited, guys. Although international recruitment has the potential to fill thousands of vacancies, we recognize that many providers find it difficult and experience a number of different barriers. This fund is being established to provide employers with a range of support mechanisms so that they are able to take advantage of the benefits presented by international recruitment. It is also designed to help ensure an ethical approach to recruitment and employment practice, and that international recruits are provided with a range of support to help them make an effective transition to working in England. Oh my God. Guys, This is everything. Is now, like I said earlier, right? They are actually helping to, boost the morale, or how will I put it? Okay, they're actually helping the international recruitment to not to have an excuse why they shouldn't recruit international candidates, right? Because they'll be providing the funds for this whole recruitment exercise. And not only that, guys, the article also states that they will be providing some form of support to these international recruits when they arrive in England, to help them settle, to help them integrate into UK. Guys, tell me, isn't this Jara on top Jara? Not only are you not going to be worrying yourself about the funds to come to this country, okay? When you get to the country, they'll also provide, they're going to bring a mechanism, that there's a mechanism in place where they will assist you to properly integrate into England, to integrate into the UK. Guys, I think it's not me that is saying this thing. Both of us, we are reading it together. So let me also show you guys the plans they have for you who is coming, the plans they have for you in integrating into this country without any stress. Let's go back into this article. Let's look at some of the strategies that they've put in place to make sure you integrate stressless, all right, when you actually migrate to the UK. They say a good example of support services, right? So there are many positive examples of good practice, which highlights often simple ways of supporting care workers from overseas to settle successfully. Some of the examples and learning come from the NHS, which has longer experience of international recruitment. So basically, they actually took some of their advice, or they based their decision on the experiences NHS has have in recruiting overseas healthcare assistants or medical professionals. So now this is some of them, okay? So guys, they also went ahead to lay down strategies they could actually use, or okay, in making the transition of international recruiters seamless, and also making it easier for these recruiters to able to bring in international applicants. So like here it says, example of support services that regions might want to develop with the allocation from this grant includes the following. One, shared recruitment activities. There are examples where partnership have created a shared job board, making it easier to reach people who want to apply from abroad. They actually know that most of these care homes, not that they don't want to, bring in overseas applicants, but sometimes the stress involved in getting applicants from outside the country, processing, going through the whole recruitment process, getting them on board, applying for their visa and all of that. The stress involved could actually discourage most of these agencies or most of these care homes from bringing international applicants. They recognize this fact, and that is why they've also lay down a strategy where they can actually partner with these recruitment agencies, which I'm actually going to be sharing with you guys after towards the end of this video. So they've laid down a strategy in the sense that these care homes who are actually short of care assistants can partner with recruitment agencies who is going to take the burden of recruiting, sourcing, and scouting for this healthcare assistant, going through the whole recruitment processes and getting them on board. All right, so that's one of the strategy they've put in place. Guys, isn't this great? This is actually mind-blowing. So what are you waiting for, guys? It is not the end though. Let's go back and see what else they have in stock, or the strategy they've laid down. Another strategy is ethical recruitment. I know this doesn't have to do with you guys. This is basically the whole headache of the recruitment agency, right? But I said it is important that all international recruitment adheres to the code of practice. Support could include advice for providers about the code of practice and how to use ethical recruitment agencies. It could also be focused on providing safeguards for employees, right? So basically, these are just code of practice for this recruitment agency, the guidance on how they could, successfully go about recruiting recruiting international applicants. Then again, the license or visa application and pre-employment checks. The license or visa application process can be perceived as burdensome. A shared resource could ensure economics of scale and increase local expertise. This has nothing to do with you guys. So this is the headache of the recruitment agencies, right? It still boils down to the care home looking to partner with this recruitment agency that's going to go through this whole stress of, through the whole practice of getting you guys on board. So let's go down, let's go forward to see what concerns us, right? Travel to the UK. New care workers will need to book flights and transfer their belongings. There are examples that show how a join up approach can ease the burden on providers. Guys, you can see they're actually thinking of you guys. The stress and all of that is going to take you to finally take your belongings and your family and come into the UK. They'll be providing laid down approach on how your burden can be relieved. Okay. Apart from that, affordable accommodation. This is particularly important to international recruits because of the overseas shortage of accommodation and the difficulty of accessing it as a new arrival to the UK with no domestic credit history. Example include providing temporary accommodation at scale or support with finding flat shares. Oh my God, guys. God, like this is good, guys. This is good. So, guys, you've seen it for yourself. This is not someone telling you any gist now. You read it directly from the Gov website. Like, apart from all of this, and the fact that you don't even need to pay anything right now to come because it's now being funded by the UK government. They are also still thinking about you when you come into the country. How are you going to get accommodation and all of that? They're laying down strategies to enable you secure accommodation. It's no longer it's no longer history, or it's no longer news that getting accommodation is in the UK is actually very stressful, especially as a new immigrant. So they've already thought about it and they're making provision for you to get accommodation on arrival. Either they find you a temporary place or they get a flat share for you. Whichever be the case, you're not going to struggle in terms of accommodation once you come into the country. Guys, this is mind-blowing. Like I said, this is Jara on top Jara, guys. This is good, guys. Honestly, this is good. What are you waiting for, guys? You need to start now thinking on how to start getting your documents ready. You just need to package your CV, okay? Package your CV. Like I said, if you don't have experience right now, there's enough time for you to gain this experience. Try to gain this experience, put it in your CV. Go to most of these care homes. They're everywhere. All right, go on Google, search about care homes in your area or stuff like that. Go and do voluntary work. Even 1 month voluntary work is enough, because basically they'll be texting you, or if you are able to secure an interview, it's mainly going to be on your experience. What experience have you had? They're also going to be giving you case scenarios. All right, if you want me to talk about tips, or let's talk about the kind of interviews you will likely encounter, the kind of question that might likely come up in a healthcare interview. If you want me to talk about that with you, I can do it, because I've been opportunity to go for over 5 different healthcare interviews, right? So I could tell you based on my experience. So what I'm trying to say is that mostly the question they ask you are your experience, not about the certification, because there's no way you have an healthcare assistant job that they'll bring you into the country and you start working immediately. It's never done. They will always train you. So always train you, give you any certification you need. So basically they just want to know if you've had any experience. Okay, so guys, that is it. Now that you've seen the whole pack and everything, I hope you don't have any reason why you shouldn't take action right now. Now let me go into the recruitment agencies you can actually use to start applying for this job. I'm going to be dropping the link to these agencies on the comment section, so you can head to the comment section and go through this whole list. These are agencies who are owned and managed by healthcare professionals. They specialize in recruiting healthcare assistants and nurses to to England, to the UK. So number one is Caremark. All right, please go and check them out. They have opportunities for overseas applicants on a rolling basis spread throughout the year. Another one is Sense Care, right? So please check these agencies out. We have nursing personnel, and we have Iva Care Services. Okay, Iva Care Services is one of them, guys. Like I said, that is what they specialize in: recruiting temporary and permanent care assistants to England. Okay, another one is called Mayday Healthcare. Mayday Healthcare. We have Castle Recruitment. We have Tombury Nursing Home. We have Calvary Healthcare. We have Willis Care. We have Cromwell Medical Staffing. Guys, all these recruitment agency I just listed, I'll be putting the links to their website on the comment section. So please head directly to this link and start submitting your application. You never can tell, right? Now that there's fund available, hopefully this recruitment agency wouldn't have a reason why they shouldn't be recruiting overseas applicants. Okay, so guys, if you've benefited from this video, please, why not you like, so that Facebook will actually recommend it to other people, and also share it to friends and those who are looking at actually moving to the UK through the healthcare route. This is great. This is all we've been waiting for, and I believe that between now and 2024, you guys would have, had so many outbreaking testimonies from this new funded program, guys. This is great. I'm super excited. Don't forget to subscribe and click on the red notification bell. I'll see you guys in my next video. Bye.